Yesterday, there was an intro session in Armed Medical Corps, and many questions were asked from the students. I first of all want to cover all those questions and want to see that how much capable you are in answering those questions. First of all, there are certain students who have given their views, and then I'll talk about our students also, the questions. You tell me, first of all, one important question which was asked by AMC on 5th December. Management of hypovolemic shock. Tell about it.
Sir, whenever patient presented with hypovolemic shock, first of all we have to do is we have to gain the IV access line through which we can give the IV fluid. So two large bore needle cannula, which is usually in green in color, 18 gauge cannula, we have to insert at two upper limb, or whenever the access is easy, so we have to insert that, and we have to start immediately the normal saline. And we have to send some basic investigation like CBC, LFT, RFT, urine routine microscopy, and then we have to check BP again after half an hour, 30 minutes. Once 30 minutes, after 30 minutes, we have to check BP. If the systemic blood pressure is not able to increase, then we have to start on inotropic support. Inotropes are those agents which strengthen our heart contractility. So the force will increase, so blood pressure will increase. So definitely we have to start with the noradrenaline inotropic agent, which we have to use as a 2 ampule IV infusion at slowly rate. If the BP is not improved, and simultaneously we have to also measure the urine output also. If we are giving fluid but patient is not able to pass urine, then we have to insert a Foley's catheterization, and then we have to measure urine output charting. Once the patient urine output is stable, then how much amount of urine patient is passing, according to that we have to set the flow of the IV fluid. And if needed, we can add, if urine output is not there and BP is still low, then we can go with the dobutamine and all other kind of the inotropic agent. And obviously we have to rule out any cardiac situation, because major of the hypovolemic shock can be due to the cardiogenic shock. So we have to do echocardiography and check the ejection fraction, how much amount of heart is pumping.
Okay. Now tell me about precipitated labor.
Sir, precipitated labor is one of the among of the stages of the labor. There are total 4 stages of the labor in normal level. First is a dilatation of cervix. The second stage is a crowning. Third stage is delivery of baby and placenta, and fourth stage is observation. Precipitate labor, it is known as whenever we induce labor or we augmented the labor, then it is known as a precipitated labor. Like we have an emergency condition like eclampsia, preeclampsia, cord presentation, cord prolapse. These kind of the situation we have to precipitate the labor. So this kind of scenario is known as a precipitated labor.
What are the dietary advice to pregnant women?
Sir, pregnant woman, definitely in first trimester, there is a routine what a normal person consumes calorie, same requirement for first trimester, for first 3 months and first 4 months. And for next trimester, we have to get additional 340 around kilocalorie. And definitely we have to give iron and folic acid tablet because of for the prevention of the neural tube defects and other iron deficiency anemia or any kind of megaloblastic anemia.
Okay. Tell me the treatment and management of acute coronary syndrome.
Sir, there are 3 major spectrum in acute coronary syndrome. First is unstable angina. The second one is NSTEMI, and the third one is STEMI. If the person develops STEMI, then obviously the STEMI is known as a heart attack. If the person had a heart attack within and patient presented to hospital within 90 minutes of time, then the ideal treatment will be percutaneous coronary intervention. That we have to taken the patient for the coronary angiography, but patient presented after or 90 minutes or within 6 hours of the time, we have to thrombolize the patient. with agents of like alteplase, streptokinase, and tenecteplase. And after 12 hours, we have to treat ST elevation MI is like non-ST elevation MI. We can heparinize the patient, and we can put on the low molecular weight heparin, which is known as Clexane, and other lipid lowering drugs. Once the patient is stabilized and stable, then we can shift patient to ward from coronary ICU, and then we have to give a dual antiplatelet drug and a lipid lowering drug for the rest of the life. And of course, we have to take care of diabetes and hypertension. If the comorbidities are existing, then we have to treat the comorbidities also.
One more important question which I found it, ECG changes in MI.
So first of all, MI is due to the suppression of the blood supply to the myocardium, the muscle of the heart. Whenever the muscle of the heart gets less blood supply, the ECG changes will show changes. Like first of all, there is an inverted T wave, which indicates there is ischemia of the particular muscle. And then the segment, which is known as the ST segment, the isoelectric segment, which is get displaced. If it is gets displaced downside, then the condition is known as a non-ST elevation MI. But this segment shows the elevation, then it is known as a ST segment elevation MI. When the ST segment elevation MI sets in, it means the myocardium is dead. That portion of the myocardium will not able to recover.
One more important question which was asked yesterday is TORCH, TORCH.
Sir, torch are the infection which could be in the form of the congenital infection or the pregnancy related infection. T stands for the toxoplasmosis, O stands for the other infection, R stands for the rubella infection, C for the cytomegalovirus, and H for herpes simplex virus. If among of these agents, if the mother acquired infection from outside or any source, then there are highly chances of the transmitting the infection to the fetus or the baby, which can set up the congenital syndrome and lead to fatal complications.
Okay. Another important question which was asked is hernia.
Sir, hernia is defined as a whenever the bowel segment, when it's came across through the layers of the peritoneum and loops into and strangulate into the sac. This condition is known as a hernia. There can be several type of hernia: inguinal hernia, which is direct inguinal and indirect inguinal; femoral hernia, umbilical hernia, epigastric hernia. In hernia, we can it's a surgical emergency, so we have to take a patient to the emergency OT. Then we can manage laparoscopically as well as open laparotomy, which is herniorrhaphy, and we can have put a mesh to correct the defect of the wall.
Anterior fontanelle clinical importance.
Sir, anterior fontanelle, which is typically observed in, there are two importance of the anterior fontanelle. If the anterior fontanelle is bulged or it show the slope upwards, it means that the person is having, the baby is having hydrocephalus, means increased raised intracranial pressure. It can be due to any situation. And whenever there is a dehydration of the baby, the anterior fontanelle will be shrink or depressed.
Tell about biological waste management.
Sir, biological waste management in hospital settings, we have a particular color coding for the each type of the waste management. Like a plastic waste, we have to put in the blue color bag. The human waste, we have to drop in the yellow color bag, and the red bag is for needle and another hospital equipments.
Yesterday I gave you medical topics. Have you covered all the topics?
No, sir. Some I have to, but I have taken idea of little.
Okay. Okay, tell me, I'm asking only from AMC right now. Chronic liver diseases.
Sir, a chronic liver disease is a spectrum of diseases which do not manifest like short period of time. There is always stimulus required for the chronic liver disease. Like in India, few years ago, the major cause is alcoholic liver disease, but right now it is a non-alcoholic fatty liver disease. And there was other causes also, like cirrhosis of the liver, infection like hepatitis A, hepatitis B. If there is a tumor of the liver like hepatocellular carcinoma, then prolonged obstructive jaundice. These kind of the etiology can lead to the CLD kind of disease. In CLD, basically there is a loss of the liver parenchyma and shrinkage of the liver. So the architecture of the liver is lost, so total loss of the liver function, and ultimately the patient will develop ascites, portal hypertension, and hepatic encephalopathy, and eventually patient may lead to sepsis and multi-organ dysfunction.
One more question which was asked yesterday. Classification of burns.
Sir, there are three major types of burn. First is a superficial burn, which involve only epidermis. The second degree burn, which involve dermis, superficial skin, superficial fascia, epidermis, and dermis. And the third degree burn, which is severe burn, which involves the inner layer also, like from skin to muscle, whole layer, the tissue part or the muscle part is getting involved. So this kind of burn is classified into third degree burn. And there is another specific type of burn, which is a filigree burn, which is due to electrocution.
Rabies vaccine.
Sir, rabies vaccine is for the bite of the reduced animal, which includes not only dogs, but also the dog, cat, and monkeys, and as well as snake bite. So anyhow, if the animal has bitten the person, then we have to give the rabies prophylaxis. So basically, we have the human rabies immunoglobulin, which available in the market. So we have to give usually 4 doses, usually 0, 3, 7, 21. And we prefer the intralesional location, and some of the clinician prefer the over the deltoid muscle also.
Okay, tell me about pneumothorax, breathing pneumothorax.
Sir, pneumothorax is an emergency, respiratory emergency, and pneumothorax is basically accumulation of the air inside the lung. So whenever there is accumulation of the air inside the lung, obviously the trachea will deviate to the opposite side, and it depends how means what type of the pneumothorax are there. There are 3 type of the pneumothorax: open, closed, and tension pneumothorax. Tension pneumothorax is extreme emergency. We have to diagnose the pneumothorax by auscultating, and another chest X-ray is the easiest investigation to diagnosis for the pneumothorax. And for the immediate management, we have to call general surgeon or the respiratory physician to put ICD, intercostal chest drainage tube, and we have to connect it with the sealed water bag. Like so, the extra amount of air which is coming out from the drain, and it can soak into the water. So this is how we can manage the tension pneumothorax, and we have to intubate the patient if needed.
Tell about vaginitis.
Sir, vaginitis is an infection of the vaginal flora. Whenever there is a decrease in vaginal flora, so there could be chances of the infection, and the acidic pH is responsible to fight with the infection. But still, there are so many types of the vaginitis are there, like bacterial vaginosis, and it could be due to the fungal vaginal infection. And specifically in vaginitis, the patient will develop the irritating and itching over the surface of the vagina. There is a numbness sometime if it is a viral infection, and we can treat as with systemic antibiotics and as well as local antibiotic if there is any blister or anything scar like this present.
Okay, differential diagnosis of left iliac fossa acute abdominal pain.
Sir, left iliac fossa or right iliac fossa?
Left iliac fossa.
Sir, left iliac fossa, we have usually sigmoid volvulus is there, appendicitis is there, cholecystitis pain can radiate to the left iliac fossa, and the major thing is diverticulosis, which is the second most common cause for the lower GI bleed. So anything subacute intestinal obstruction, these are the differential diagnosis for the acute abdomen, specifically in left iliac fossa.
Almost on 5th December, what was asked, we have already discussed all the questions and you answered very well.
Yes. Yes, sir.
Although one thing I want to advise you, like you answered in little detail, okay? So here,
Yes, sir.
I want to give you a good advice. You come on the video call, I'll tell you that what type of advice is required here to while answering, especially medical answers. Sir, did your MBBS?
Sir, I have completed my MBBS from SSR Medical College, affiliated to University of Mauritius in December 2020. And then, sir, I have passed my FMG examination in my very first attempt in June 2021. And I have done my internship from BJ Medical College, Civil Hospital, Ahmedabad, which is Asia's largest civil hospital.
Okay. What you learned in interns?
Sir, in internship, of course, I learned so many things because in internship we are posted according to our roster. There is a whole there are all clinical subjects was there, and I was posted accordingly. First, I was posted in ENT department, then I posted in dermatology department, psychiatry department, medicine department, surgery, pediatric, OBG as well. And each and every department, I have learned that how to see the OPD, like what the investigation are necessary in the OP patient, what the investigations are necessary in IP patient, and if the patient is indored or like admitted, how we have to approach the patient, like how step by step approach the physician must hold. That I have learned from the internship.
Okay, you studied in Mauritius. Definitely, there might be some changes or differences you find in the education. So, what difference you find?
Sir, luckily, my medical college was established by our Honorable ex-Prime Minister Bajpayee ji, and the curriculum was totally same as the Indian curriculum, which are usually followed in our Indian medical college. And also, our professor used to be Indian. But yes, I can see in comparison of primary and secondary education of Mauritius, which is controlled by totally British Cambridge University. But the medical education, which is controlled by the Indian Ocean Society, like SSR Medical College, which is funded by the Indian group of people.